Good morning, and welcome back to Good Samaritan Facebook Live. My name is Dr. Scott Stine. I'm a family physician here in Vincennes, Indiana, and Chief Medical Officer of Good Samaritan Physician Network. I'm joined with me today, as usual, Adam Thacker, who's our Chief Operating Officer. We'll be giving you a general update on COVID in our community, where we're at with our numbers, positivity rates, what's happening with vaccines, and kind of where we see things have been for the last month or so, and where we're at now and where we see ourselves going over the next month. So just in general, the numbers we always talk about are how many cases we've had from the beginning, about 3,400, but really the important numbers we always go back to are the 7-day positivity rates, and the all positivity rate for us is around 7%, which is underneath what the state's rate is, and then around 18% for those unique individuals, with really under 100 active patients in the community, which is tremendous. If we look back, I honestly don't remember 3-4 months it's been probably that we've had those low numbers in terms of the active patients in our community.
Right. Yeah, really seeing those trends moving in a very positive direction, and good news is that that's also correlating with what we're seeing here at the hospital from an acuity of illness. Our census of COVID patients, and especially those requiring ICU level care, is as low as it's been since last summer. Single digits, really promising. And as that continues to move forward and is mirroring up with the state, as we get below that 10%, which we are, and kind of holding that steady, that's where discussions start to be able to happen about how we open things back up. And we were talking a little bit before, 2 weeks ago, the 92 counties in the state of Indiana, 73 of them were in the red. So they were increasing in positivity or had the number of cases per 100,000 that was above the threshold. And just this, if you go out and look at the map today, there are 5 counties that are in the red. So most have moved to orange, really seeing that statewide trend towards the positive. Now, we approach that cautiously optimistic, and that does not mean that you get to abandon the mask or social distancing or hand hygiene, which should stay in place forever. All of those things need to stay in place as we move through this cold winter season, where there's the potential for a surge really at any time that we're not being cognizant of that. But the governor did pass the executive order through February that still holds in place the masking mandate, those measures, but are starting to look at the red and orange color coding and capacity within facilities. We're at 25% capacity. Our social gatherings are at 50 or less, and then anything outside of that kind of holds true with how it's been in the past, that would require a health department approval to move forward. But it's good to be having those conversations, and things look really well.
And really the thing that we like to see is consistent decline. If we look back right after the holidays, we were very concerned because we have seen a significant rise within 1 to 2 weeks after every holiday. And really, I think that rise was blunted after our New Year's holiday, which was fantastic. And then we have seen a decline and continued low numbers over the course of the past week or so, and we hope that continues. And as Adam said, probably one of the most important things that we're seeing, if we look at who all has been vaccinated, total number of vaccines that have been given here, it's around 8,000 vaccines, which is a tremendous number. If we look back as we were preparing for this back November, December, I don't think either one of us would have thought we would have had this many people vaccinated this early on.
No, it's been tremendous response from our community as the eligibility has opened up, and initially with our healthcare team and our first responders as that eligibility opened up. Just seeing individuals really go out, do their due diligence and getting educated on the vaccine and safety, efficacy versus getting COVID, and how we move forward. And we've talked about that was the light at the end of the tunnel, and we continue to move towards that light. That light's getting a little brighter every week, and so we're moving in that direction. Of those 8,000, about 25% are first and second doses have been administered, so that's the fully vaccinated group. And as we mentioned in the past, Knox County really leading the way as a per capita vaccinated county in Indiana, and that's exciting because that continues to move us towards those reopening of the state. State is north of 500,000 vaccines administered thus far, and it was reported through the governor's update that Indiana, as far as Midwest, is one of the leading states in getting vaccine rolled out. About 60% of the vaccines that have been allocated to the state have been administered, and that continues to increase. We did learn that starting this week, the federal allocation to Indiana will go up 16%. Ballpark of 80,000 vaccines per week will now go to about 95,000 vaccines per week. Sounds like a big jump, but spread that across 92 counties. Don't anticipate that means Good Samaritan, Knox County are going to get thousands more vaccines. We have put in to increase our capacity by another 50 vaccinations per day. Some of that in anticipation of what we were speaking about. We do anticipate this week that eligibility will continue to open up on that age-based criteria, so moving from 70 to 65. We don't have a exact date, but we do anticipate that will happen this week, and the access point will be the same. ourshot.in.gov, call 211. Don't directly call Good Samaritan. Go through the website, go through the 211. The 211 process, which I think was overwhelmed at the beginning, has now been improved. It's been staffed up. I've heard good reports as far as getting individuals registered and getting them signed up for the vaccination in their area. So we've got the health department working out of the CUMC behind the movie theater, and then Good Samaritan are the two local Knox County vaccination sites at this point.
I have a number of people that will ask me, when I call to sign up, I get asked, what vaccine do you want? Where do you want the site? Basically, it doesn't matter. At this point in time, the vaccines are essentially equivalent. The reason they've been divided up as they are has more to do with how that vaccine is kept in cold storage than it does with anything else, because the numbers and the efficacy of both vaccines are excellent at this point in time. And yes, just as Adam said, that system, that process of calling, registering, going online and registering is actually very smooth now. When they first opened up, it was simply a volume-based problem. But really the exciting thing, I think, from our standpoint is we really haven't had any times when we haven't had enough vaccine to continue to mass vaccinate as we planned.
Yeah, we've been very fortunate that the state supply chain has worked very well for us from a hospital standpoint. We're receiving the Pfizer vaccine. In general philosophy, hospitals are receiving Pfizer. Health departments are receiving Moderna. That's really just based off of storage, ultra cold storage for Pfizer. Hospitals have that capacity. Health departments that are in a remote location don't have that availability. We're getting another shipment today. I just confirmed before we got online here that we would be getting that shipment. So we continue to get steady supply. I know the health departments across the state from a Moderna standpoint have been a little bit more strained in getting enough vaccine, but the Pfizer supply has continued to really be something that we have been very positive in being able to stay ahead of the game in our vaccinations. So as your eligibility comes up, make sure that you are getting that appointment as soon as you can, because looking at it today, if you go on to sign up for your first vaccination, it will be February 9th. I mean, that's just we're booking about a week out. As we can increase capacity, we will. But right now, we're booking a week out. So you can't walk in, you can't sign up just same day, get the appointment. You've got to plan for that.
Yeah, and I think one of the things Adam mentioned earlier that I get asked frequently is, are we seeing these declines because of the vaccine? And I think there's no question that that's the case. If we look back as to when our vaccination started, when all of our first responders and frontline workers started getting vaccinated early on, and then march that forward and realizing that really the efficacy in being fully vaccinated after your second dose a couple weeks afterwards, we're definitely seeing declines as a result of that. And as Adam said, the thing that we're really excited about is the acuity of the patients that we have been seeing, the sicker patients who've been in the hospital ventilated. We've seen a significant decline in that. And when you guys report each day on the number of inpatients that we have, those have been single-digit numbers for the last week or so. The number of ICU patients or ventilated patients have been 1 or 2 in the last few weeks or so. And that's very exciting to us, because although we never really reached the limits of what our capacity would be, it's so much means so much to us to see those numbers declining and realizing that our sickest population, our most at-risk population, is now being protected based on how that vaccine rollout went.
Sure, and it's really about when you're looking at mass vaccination and how that rolls out. There is a preservation of societal function, and that's where the healthcare workers and the first responders come in, and then there's preservation of life. And so the way that the state looked at it was our 80 plus was a small percentage of positive, 6-7% positive, but it was 50% of the deaths. And then 70 plus, and now moving to 65 here, anticipated this week. We're seeing more states come online with looking at an age-based approach because of that's the highest risk to be hospitalized, and ultimately that's the highest risk for death. So as has been the case since March with COVID, decisions are made based off of the information in front of us, and everybody has an opinion of what that decision could be. Essential workers and who kind of fits into those buckets versus age. I think from a simplistic standpoint, age made sense, and it also was focused on hospitalizations, preserving life, and so that's why that model has been rolled out the way it has, and is proving to be successful as the whole state is seeing decrease in hospitalizations and decrease in death due to COVID.
And a number of individuals will ask me, although I'm not a candidate for the vaccine, am I a candidate for the monoclonal antibody infusion? And the answer is we have seen amazing changes in patients' courses with the administration of the monoclonal antibodies. And primarily that is in some of our highest risk patients, but even patients with just a single diagnosis of obesity, chronic kidney disease, diabetes, hypertension, those types of things puts them at a higher risk. And so all of those criteria are things that we use along with age to determine if you're a candidate for the monoclonal antibody infusion. Dr. Mahan and I have been supervising that over the course of the past month and a half or so, and what we have seen in terms of utilization of that is we were at one point in time during our peak probably seeing somewhere between 7 and 12 administrations of that monoclonal antibody per day, and looking at that over the course of the past week or so, maybe down to as little as 1 to 3 per day.
Yeah, really exciting, and monoclonal antibody kind of got its 15 minutes of fame right before the vaccine rolled out because we were seeing that bridge and it working extremely well, and then the vaccine came online and it got a little bit overshadowed. But the numbers have been tremendous, a less than 1% admission rate for patients that have received monoclonal antibody treatment. We're now seeing that there's discussion in trials about using that even prophylactically for high-risk individuals that are exposed. Just like the vaccine, it comes down to supply. Can we meet supply versus demand, but have really had tremendous results with a population that 20 to 30% would have been admitted is now, some studies have said 6%, we're seeing less than 1%, has had a dramatic impact in our community to the good in our response to COVID.
And really, it's still everything we have said over the course of the past month and a half remains the same, which is if you develop symptoms and if you feel like you are getting ill, please, number one, contact your provider, see us in convenient care, get in to be seen and be evaluated. We want to see those individuals, determine what their risk is, find out if they truly have a positive test, and then in most cases, we're able to evaluate them, get them tested, and then administer that monoclonal antibody the same day or the very next morning. And so it's still very important to identify that early in the course. I've spoken with dozens and dozens of patients over the course of the past few months who have developed the illness, had symptoms, got tested, received the monoclonal antibody, and especially when it was in the first few days of that illness, that turned their illness around very quickly. And so we really want to emphasize the importance of early intervention and getting that monoclonal antibody infusion in those first few days. And a lot of patients will tell us that they just barely started to develop symptoms, got the infusion, and within 1 to 2 days we're back to normal.
Yeah, and as you mentioned, it all starts with identifying symptoms, getting tested. If you don't have a primary care provider, aren't familiar with how to navigate the healthcare system, not sure where convenient care is, our triage line is set up, 885-3331. We staff that with clinical staff. They can help to guide you to a physician, to a virtual visit with a provider, to go to convenient care, where the testing sites are. They can help you with all of that navigation. If you're starting to feel symptoms and just not sure what's the next step, call that number. We can post that afterwards on our social media as an update. It's on our website with our coronavirus page. But certainly that's a resource that you can talk to a live person and they'll help get you to the right place.
Right. One thing we discuss every week is where we're at with our visitation policy, and every day we're evaluating where we're at with that, where things are going to be. Nothing has really changed over the course of the past few weeks or so, but we anticipate that we'll be reevaluating that a little bit more over the next few weeks.
Yeah, we continue to look at it. This week, our group's going to pull together and talk about what does that look like now based off of where we're seeing numbers and trends and everything. This goes back to that cautiously optimistic. So we're not making quick changes to say, okay, we're going to open everything back up based off of where our numbers and positivity rates are today, but certainly are cognizant of having family at the bedside, having caregivers be able to be a part of patients' healing process. Right now, it is one visitor in our inpatient setting from 10 a.m. to 6 p.m., and then in any ambulatory settings, outpatient surgeries, medical offices, no visitors except for those involved in medical decision-making where patients need that support person as part of the medical care. So we'll continue to evaluate that. This is something that we work through what's called the Patient Safety Coalition, which is a Southwest Indiana region, and we are all working on this for consistency. So that group met last week, and it was a decision across Southwest Indiana hospitals that we would stick with this visitation process, and we'll continue to evaluate that, and those changes will really be made on a regional standpoint for consistency.
Sure. And as we go over the course of the next few weeks or so, again, we want to emphasize what a great job our schools have been doing, despite the occasional 2-hour delay because of weather. Schools are back in session, in-person learning, that has been going well. So again, congratulations to all the schools for doing an excellent job with that, as well as all the students. Really looking forward over the course of the next couple months or so. We've got holidays coming up. We got Groundhog Day. That's big. We've got Valentine's Day. Probably more importantly, we've got Super Bowl Sunday coming up. We've got spring break. Don't confuse the thought of 90% alcohol as being prohibitive of the viral illness, and use that as a measure to protect yourself. We want you to be safe in other manners. But really, thankfully, now that we've made it through the big holidays at the end of the year, I would really just emphasize that people make plans in terms of what they're looking at as far as gatherings. Super Bowl Sunday is a big event for a lot of people. And then, of course, planning for spring break. And as you and I were talking about before we went live, we're sort of coming out of the fog, and we're really hopeful that as spring comes around that we have a high enough percentage vaccinated that we'll gradually start chipping away at some of the restrictions. But people right now are looking at what spring break's going to look for them, and we would still encourage people to look at that in terms of within your own family group, keeping that conservative and being cautious about what you do and where you're going. Any other things before we go to the phones this week?
Only other thing I would mention, because it continues to get a lot of press, is the variants
Sure.
with COVID, the strains. There are now kind of 3 that are being highlighted from the UK Britain strain. There's a Brazil South American, and then the South African, and all of those have higher transmission rates. 2 out of the 3 are considered to be more virulent, so higher acuity of illness. The vaccine is effective against those strains. The efficacy is continuing to be tested as to how effective, but it is effective, and it wouldn't take much to go out to the World Wide Web and take a look at
Sure.
what's going on with those strains to understand that we have to get vaccinated faster, and everybody that is eligible should be getting signed up and getting vaccinated, because the faster we get ahead of that, it stops the ongoing transmission, thus shuts down the mutations and the strains from becoming less, from the vaccine becoming less effective against those new strains. So really encourage everyone to look at that as that last sense of urgency for why to get vaccinated, is because those strains continue to make vaccines less effective unless we can get ahead of it.
Absolutely.
Okay. We have a few this morning. So the first one, if you have had both of your vaccine shots and it is at least 2 weeks since your last dose, if you are exposed to COVID, do you still have to quarantine?
Yeah.
No, yeah.
So great question. And actually, we had our discussion around this with Dr. Stewart from a health department standpoint. And right now, if you still have to wear a mask, but if you have had both vaccines, you are past kind of that 2-week period where it would be considered fully vaccinated, you do not have to quarantine unless there are any symptoms. Obviously, if you have any symptoms, then you should consider yourself potentially infectious and would need to quarantine. But as long as you are asymptomatic, and are continuing to follow all of the public health measures very closely, then you would not have to quarantine.
Yeah. One thing that has come up on a couple occasions has been people who receive perhaps their first vaccine, and then in between their first and their second, they contract COVID. And I've had a lot of questions about that as to how that can happen. And really the studies that show that 90+% efficacy rate is after people are fully vaccinated. Right. So they've received their first vaccine, their second vaccine, it's been at least 2 weeks or so. So during that period of time, it's still important to realize that you can still contract the illness. We still want you to follow all the same guidelines as we've spoken about all along. And then, of course, contact your provider if you have a significant illness that's going on as a result of it. We have had at least one occasion where somebody did meet criteria and then require the monoclonal antibody infusion, which complicates things a little bit in terms of how will that monoclonal antibody affect their second vaccination. But our advice to those individuals has been, if you have recovered from your illness, it is fine to go ahead and get your second vaccine, because we want your body itself to form those antibodies that will help to protect you from it in the future. What we're doing is passively vaccinating people with the monoclonal antibody infusion. What we want is active vaccination, where we have your body respond and then protect you in the future from the virus.
Okay, this next one is kind of a two-part question. So, is there a list one can get on if all the vaccines are not administered in a day, that they can be called to come immediately and receive the vaccine? Or if one is not 70 but has another illness, can they participate early?
So right now we do have a waiting list, is what we will call it. It's a pretty long list, so we have not been adding to it. At the end of the day, our goal for the vaccination clinic is that no doses are wasted. And of the 8,000 administered, I can confidently say we have had 0 wasted doses. So the way that works is oftentimes we look ahead at the schedule and we're calling those that are eligible to move up a day. That opens up additional spots. We've been successful in doing that. And then we also are within our own employees going out and offering that vaccination if somebody hasn't had a chance to register, or if their second dose, if they're within that window, then we can go ahead and give a second dose. But there is a wait list. Right now, it's a very long list. With this week, with it expanding from 70 to 65, we're not adding to that list right now, so there's not something to call in and get on. As we go to 65, really that comes down to if you start to see that the clinic is not full. We're not at capacity, but as I mentioned, we're booking a week out. We're running 90+ capacity at over 300 vaccines per day. So pretty easily we can work ahead in the schedule, call somebody, get them in to get vaccinated. If we start to see that we have openings, then that 65, basically we'll look at 60 to 65 as being able to be on the wait list.
Okay. If you are scheduled through your work already, where do you go to get the shot? The hospital or another place?
So we have 2 sites in Knox County, and you need to be cognizant of where you're scheduled. So if you are scheduled at the Knox County vaccination clinic, that is at the CUMC Church behind AMC Movie Theater. And if you're at Good Samaritan, then it is here at our main campus. You enter under the green awning, 6th Street, you'll see the signage. But we have had some folks, and we work very closely with the health department. We have had some individuals scheduled here that have went there and vice versa and have to redirect where to go. Of course, that has to happen if it is the second shot, because we're using 2 different vaccines and they're not interchangeable. So we want to make sure that first dose and second dose are the same vaccine. But as far as where to go, pay attention to your appointment. If it's through your employer, and we've had some cases where through an employer there's been one point person that has registered multiple employees based off of their eligibility, then make sure you know who that person is at your employer and ask where they are registered, if that's the health department location or if that's the location here at Good Samaritan.
Okay. If someone's PCP is not familiar with the vaccine, who can they talk to about allergies and recommendations for getting the vaccine?
Sure. So certainly your PCP is generally going to be your best source of information with regards to that. The health department, our information line, the 3331 line also can be very helpful. And then certainly contacting any of us here at the hospital or convenient care clinic. We're all very well versed in those things. But the bottom line really is that there are very few true contraindications to getting the vaccine. Those are really only individuals that have had severe reactions to vaccines in the past. The way that this vaccine has been manufactured is different than what we've seen in prior vaccinations. And so when people say, hey, I had a flu vaccine 30 years ago, I had a reaction as a result of that, we wouldn't even consider that a significant reaction to vaccinating with influenza now. So similarly, the majority of the time, even if you've had minor reactions or other things like that, we would still encourage you to get vaccinated without any hesitancy because of the way that it was manufactured.
That's it.
Okay.
Okay.
Any other things for closing, Ed?
No.
All right. Thank you all very much for joining us. We'll be with you again in a week. And again, if you have additional questions, please post those online, and we'll try to get to those throughout the day today. Thank you.